Hi, I'm Candace with Licensure Consulting, and today I want to talk to you about some specific language and abbreviations that we use in the home care world. Now, there are a lot that I'm missing. There's literally thousands and thousands of these little letters, alphabet soup, abbreviations, and things that people use. But I'm specifically today going to talk about ones that are relevant to non-medical home care, and even more specifically in Texas. So some of this may make sense to some of those of you that are in other states. But specifically, I got all of this language from Texas. So if nothing else, hopefully you can learn something today and make some notes and at least have some reference points in which you can go then look up in your own state to see, if you have similar programs and policies and things. Okay, so home care. We'll just start out with the word home care. A lot of people confuse home health and home care. So when I use the word home care, and at least in Texas, we specifically are referring to non-medical or unlicensed personnel that are going into clients' homes to provide hands-on assistance. Companionship care is typically a little bit different. It's paid for by Medicaid, MCOs, out-of-pocket, and long-term care insurance. Mostly by Medicaid programs and MCOs and out-of-pocket, but long-term care insurance is becoming a little more popular. And then there's home health, which is the medical side of that. So that is services that are provided by nurses, physical therapists, social workers, and such. And that's paid for by health insurance, both private and Medicare, as well as the state Medicaid programs. And then there's just a whole bunch of abbreviations. So let's start with HHS, which is the Health and Human Services. So there is, of course, a National Health and Human Services, and then most states have an HHS of their own. In Texas, the majority of all of our licensure has been consolidated to HHS, Health and Human Services. SOS, Secretary of State. That's where you go to get your LLC, limited liability corporation, or an incorporation, an S Corp, all those different kinds. C Corp, I think, is another one. But that's where you go to the state to register your actual business license with the state. TULIP, TULIP, Texas Unified Licensure and Information Portal. That is where you will apply for any sort of license. It's also then where you would report incidents and things once you are an agency or a facility. HCSA, Home and Community Support Service Agency, HCSSA. That is the type of license that a home care falls under. And then within that licensure, there are different categories, license categories. One of those is LHH, Licensed Home Health, which is no Medicare. The other is LCHH, Licensed and Certified Home Health, which does include Medicare. And then, of course, hospice, which is the medical and palliative or comfort care for patients with a life-limiting illness or diagnosis. And then we have PAS, which is my specialty, personal assistance services, which is that non-medical home care. That's the term we use in Texas for non-medical home care, is PAS. Within that, then some of the Medicaid programs that are available for PAS category of licensure are PHC, primary home care. That's basically the Medicaid version of PAS, or the PAS services that are authorized to be paid by state Medicaid. And then there's CAS, community attendant services, and CDS, consumer directed service, CLAS, Community Living Assistance and Support Services, and then HCBS, which is sort of an umbrella encompassing some of those programs I just mentioned, specifically home and community-based services. So write all this down if you don't already have it. So then we talk about CMS. You probably hear CMS says this and this and this. The Centers for Medicare and Medicaid Services. Of course, I did not actually write down here, but the CDC, the Communicable Disease Center? Centers for Disease Control. That's it. Sorry, CDC, Center for Disease Control. Should know that as much as COVID has been a thing. Okay, back into Texas then. We have TMHP, which is the Texas Medicaid and Healthcare Partnership. That is where you go to get your contract with Medicaid, to get enrolled with the state Medicaid. Then there's the NPI, which is National Provider Identification, and that is a number that is assigned to your agency. For anyone who wants to bill a government entity, you do have to have an NPI. It's not necessary for private pay only PAS agencies in Texas. to have an NPI, but if you're going to do Medicaid, you do have to have one. PEMS or PEMS is the Provider Enrollment and Management System. It is connected to TMHP, and also that then is where you enroll to get your Medicaid and the other contracts. MCO, Managed Care Organization, which is essentially like an HMO, if you remember that from your health insurance, like an HMO, but for the Medicaid system. So it is a third-party system that mimics or sort of follows what Medicaid does. It's just an additional sort of a third-party system used through the state. LTC, long-term care. Now, long-term care, according to the HHS, Health and Human Services, encompasses all post-acute services for adults. And by post-acute, I just mean anything that happens outside or after a hospital setting. Then we have some more basics like CNA, Certified Nurse Aide. In PAS in Texas, if you can get CNAs, you're really lucky. But it's not necessary to have a CNA. Your staff can be unlicensed personnel with some sort of experience. And also they can be taught. You can teach them. Then we have the EMR/NAR. And we use those together a lot, but they're on the same page on the HHS website where you would go to check employment eligibility for your staff before you hire them, and again annually. And that is EMR, Employee Misconduct Registry/NAR, which is the Nurse Aid Registry. So you use the same system and either of them might show up. DPS, Department of Public Services. It's also the driver's license office. We don't have the DMV in Texas anymore. It's the DPS. And so you would perhaps check with them to get your criminal background checks and employee eligibility there. Within the DPS, you may get a computerized criminal history, which they call CCH, or you may see the term CHRI, which is criminal history record information. All of that goes actually through the DPS. Then you have the OIGLEIE, which is the Office of Inspector General's list of excluded individuals or entities. So if you're billing any government entity, primarily in this situation, Medicaid, you actually have to check before hire and monthly that all of your staff, anyone who provides care or has face-to-face contact with your clients, that are not listed on the OIGLEIE, because if they are excluded, then you cannot bill for any services that those people have provided. It's very important for compliance, and the state does look for that when they come do their surveys. Then you have the ISP, which is the Individual Service Plan. Now that's the PAS version of a care plan or plan of care, but it is the non-medical PAS version for that. And then you have EMR again. Now we said EMR as Employee Misconduct Registry, but more commonly known would be EMR Electronic Medical Record, which is something just we use interchangeable for like a scheduling software, whatever sort of client management and staff management software you might be using could be considered an EMR. And then we have EPP, which is the Emergency Preparedness Plan. In Texas, that plan has to be activated or you have to do a drill annually to remain in compliance. QAPI, the Quality Assurance and Performance Improvement. Again, in Texas, that has to be done biannually for compliance, can be done more often. I know that CMS, the Centers for Medicare and Medicaid, do require that home health agencies have that, but every state's a little bit different in regard to what's required of the non-medical home care. Now, if you bill Medicaid for anything, then CMS is going to be important. So if you see a CMS bulletin come across your email, make sure to read it and see if it applies to you in regard to Medicaid and billing, because that could have an effect on you. ANE, abuse, neglect, or exploitation. Abuse, neglect, or exploitation. That actually in Texas requires a self-report to both the DFPS and the TULIP. And so DFPS is the Department of Family and Protective Services, which encompasses APS, Adult Protective Services, as well as CPS, Child Protective Services. And so if there is an accusation of ANE, you as an agency here in Texas would be required to do a report with APS or DFPS, and also to do a self-report on TULIP to let people know, hey, one of my employees has been accused of abuse, neglect, or exploitation, and then go through all the process. And then the last thing I have on my list is PRN, which is the medical term for as needed. It's of Latin origin, and it is something we use a lot in nursing and you may see in the medical world. So there are thousands of more. This is not all encompassing, but I've taken up 10 minutes of your time. So thanks for watching. If you have any questions, please reach out. Thanks, bye.